Good afternoon, my name is Ensign Lankford,
And I'm Lieutenant Pfaff.
and today I will be conducting a knee exam. So the first thing I would do upon walking in the room is just getting some history about the patient. So I would ask her to verify her name, her age, all those other things. And starting off, I would first just ask her what brings her in today. In this case, she has knee pain, right knee pain specifically. So from there, I would then ask a few questions to get some more details. So for example, the onset, or when did it occur? If anything makes it feel better or worse, does the pain move? The severity of the pain, what the pain feels like, and then just the timing. So if it's worse in the morning, the afternoon. I would then move on and get some more aspects of her history, such as any family medical conditions or chronic conditions that could be playing into her knee pain, as well as some surgical history, any allergies if she's taking medications for it. Then I'd move on into her social history, such as her occupation, how much she exercises, her nutrition, and her sexual history, just to get some more information behind this knee pain. I would then go in with questions of a review of systems, just to rule out any things that are red flags, such as fever, recent great weight loss, and different things like that as well. All right, so now moving on to the physical exam portion. So the first thing I would do is inspection. So looking at her knees, I would be looking for any redness or rash or any swelling. I don't see any swelling, but the main areas that I would look for swelling in would either be articular or non-articular, so in the joint or outside of the joint. And if she has swelling in the joint, it could indicate an effusion. But I don't see any of that, and her knees bilaterally look the same. And then from there, now I'm going to move on to palpation. So the first thing that I'm going to palpate is her quadriceps tendon. So I'm going to start at her quads. I'm going to come down and feel her patella. Then I'm going to move down to her patellar tendon and then her tibial tuberosity. And then from there, once I'm done palpating that, I'll start on the lateral side. And I can feel this kind of little like triangular space here, and moving from anterior to posterior. This is her joint line, and I can feel first the anterior horn, and then I'm moving back and feeling the posterior horn of her meniscus. And back here laterally, I should feel, and I do feel, her biceps femoris muscle that runs back here. And now what I'm going to do is first, moving down, I can feel her Gertie's tubercle, and that is where her IT band attaches. So if she moves her leg like this, I can feel her IT band sliding, which feels good, it feels intact. The next thing, I can move down and I can feel her fibular head, and then I can come up here and I can feel the femoral lateral epicondyle, and what attaches to both of this is her lateral collateral ligament, her LCL, and I can feel that, and it's kind of like a nice palpable pencil-like structure that I can feel. Moving on from there, I'm now going to move into the medial inspection of her knee. So feeling again that joint line and moving back from anteriorly to posteriorly. And here I can feel two of her hamstrings muscles. So you have the semimembranous muscle and then the semitendinosus muscle. And then from here I can move down and I can feel her pes. And what her pes is it has three muscles that come together. So you have the gracilis, the semitendinosus, and the sartorius. So I can feel that here. And then also in this area, it's harder to palpate on an inspection and palpation is her MCL that I can feel for as well. The next portion of the test that I'll move into is range of motion and strength. So what I'll have you do is if you can go ahead and fully extend your knees, and then go ahead and go into flexion as far as you can. I know it's a little hard at the table. So she has full range of motion with extension and flexion. So now I'm going to do some quick strength testing. So if you can go ahead and kick against me. There you go. And then again. And then if you can go ahead and pull in against me and pull in against me. So her strength seems to be intact as well as her range of motion. So the next thing I will do is go into some special tests. So if I could have you go ahead and lay back. All right. And again, for the purposes of this exam, it's her right knee that is bothering her. So the first thing I'm going to do is the patellar test. So the first thing that I'll do is the patellar compression test. So I'm just pushing down on her patella. And do you have any pain with that? No. Okay. The next thing I will be doing is the patellar grind test. So I'm just taking the patella and I'm moving it in a grinding motion. Do you have any pain with that? No pain. All right. The next thing I'm going to do is the patellar apprehension test. So I am going to medially and laterally displace her patella, and I'm just going to palpate underneath, and she's going to let me know if she feels any pain with that. So first I will medially displace her patella and feel under. Do you feel any pain?
No pain.
Okay, and then I will do the same thing laterally. Do you feel any pain with
No
that?
pain.
Nope. So that's a negative patellar apprehension test. And the last test that I will be doing to test the patella is the Clark's test. So I will have my hand on her quadricep, and then I'll go ahead and have you flex your quad, and then go ahead and unflex it, and then go ahead and flex your quad. And I'm just pushing down on her knee. And do you feel any pain with that?
No pain.
Okay. So the patellar tests were all negative. If they were positive, it would indicate the patella femoral pain syndrome, but again, they are negative. So now I'm going to move on into the ACL and PCL test. So the first test that I'm going to do is the anterior and posterior drawer test. So I'll go ahead and put her leg at 90 degrees, and then I'm just going to sit on her foot. And what I'm doing is with my thumbs, I'm finding her condyles on her knee. And then from there, I'm using them to support, and I am anteriorly trying to displace her tibia or pull it forward. But I feel kind of this like stop, so I know that her ACL is intact. I'm going to do the same thing, but I'm going to press in with my palms, and I feel a stop, so I know that her PCL is intact. So those look good. And then just to reference, I'll go ahead and put her other knee at 90 degrees. And I can see just where both of her tibias are, and you can see that they're equal. So a big thing with these tests is that if you, for example, had a PCL tear, your tibia could be sagging back. So if that happens and you're doing these tests and you're not aware that they're not equal, if you're pulling that tibia up, you could mistake it for an ACL tear. In this case, she has neither, so I'm going to go ahead and put her knee down. Now I'm going to be doing the modified Lockman test, and I just essentially have my knee underneath her thigh, and that is just supporting this. And what I'm trying to do is test, this is a more specific test for an ACL tear. So what I have is when your ACL runs from lateral to medial, so what I'm doing is I'm just trying to push her tibia up and try to see if we have any displacement, which we don't. So that's a negative test for ACL tear. And then the last test that I'll be doing to test for an ACL tear is the lever test. So I'm going to go ahead and put my fist underneath her calf. And what I'm doing is I'm pressing down on her quad. And as you can see, her heel and just in general her whole foot is coming up off the table. If her ACL was torn, it would stay on the table. So it indicates to me that she does not have an ACL or a PCL tear. So the next thing that I will be testing for is the MCL and LCL. So how I'm going to do that is first I am going to put a valgus strain to test her MCL. So I'm going to go ahead and push in. Valgus is her knee going in and her foot going out. And I'm pushing in medially, and I can see that, do you have any pain with that?
No pain.
So her MCL looks good, and I'm just going to do the same thing, but laterally for her LCL. So I'll go ahead and, do you have any pain with that?
No pain.
Okay. So it doesn't look like she has any MCL or LCL pathology, so the next thing that I'm concerned about is a meniscal tear. So I'll go ahead and do some of the meniscus tests. So the first thing that I'll be doing is the McMurray's test. So what I'm doing again is I'm using this valgus and varus strain, but I'm also including her foot. So for the first part of the McMurray's test, what I will be doing is I will be externally rotating her foot, and then using a valgus strain to internally rotate the knee. And I'm just gonna go up and down. Any pain with that?
No pain.
Okay. So now I will be testing the other meniscus. So I will go ahead and do an internal rotation and a varus strain. Do you have any pain with that?
No pain.
No pain. All right, and then the last test that I will be, or another test I will be doing for the meniscus is the grind test. So it's pretty similar. I'm just, again, kind of moving in that valgus and varus strain back and forth, and it will just kind of grind. Do you have any pain with that?
No pain.
No pain with that. All right, so the last test I'll be doing, I'll have her go ahead and stand up. It's the Thessaly's test. So essentially what I'm going to have her do is go ahead and stand on your right foot. And I can go ahead and support you. And if you could just rotate 20 to 30 degrees around. Any pain with that?
No pain.
No pain, okay. So that shows all the results of those tests, that she doesn't seem to have any meniscus pathology. And those are all the special tests that I have for you today. Thank you for watching this knee exam.